Hi, my name's Lesley Ward. I've just finished my PhD at the University of Otago in Dunedin, and I was looking at the role of yoga for musculoskeletal conditions. I was going to tell you a little bit about a pilot study I did, and I worked specifically with people with rheumatoid arthritis, just looking at a relaxation-based yoga program for them, and we were looking at helping with their symptoms mainly of pain and improving their sleep. So what we did is we used some specialised equipment here. So rather than having them get on the floor, we put them on tables and supplied yoga mats, blocks and belts. And we gave them a progressive program that over the 8 weeks they progressed from supine to seated to standing postures. What we found is that it was very easy to recruit people from this RA population, and they were very good at attending group practice, but we had a little bit of trouble getting them to stick with their home practice, so they just needed a little bit more input. One of the main outcomes I thought you might be interested in is that we looked at the 16 postures that we taught to the participants, and what we asked them was what postures did they enjoy the most, what caused them discomfort and what caused them pain. And this is interesting because we found that we couldn't find any postures that worked overall for this group. So for example, for these supine postures, while a lot of people found them very relaxing, other participants also found them either uncomfortable or that caused them pain. And this also happened for the standing postures. Some people loved them, but others found them uncomfortable or painful. So I think it's important if you're teaching a clinical population like people with RA that it's very dependent on where in the body they're experiencing their RA. If it's in their hips, you're going to find some of the supine postures mightn't be suitable. A lot of people experience RA in the feet or have had joint fusions, and the standing postures aren't as applicable. And also it depends on their disease activity, so this can fluctuate from week to week as well. For 1 week a supine posture might be fine, but if they flare up the next week then they're not going to find it appropriate. So I think when you're looking at teaching yoga to a clinical population like this, it's really important to remember all the tools in the yoga toolbox, and that sometimes it actually might be more appropriate just to actually put your participants in Shavasana and teach them the breathing and the relaxation practices of yoga.
Thank you.